A lot of kids seem to get a lot of sore throats, and sometimes, not as much as we used to, they sometimes get a surgery for it. Why is that?
If children are getting a lot of throat infections, what we call tonsillitis, where the tonsils get infected, and it's happening too many times, and the child is suffering from it, and they're on a lot of antibiotics, and they're missing school, at some point we would consider tonsillectomy, which is a very old, safe procedure where we take out the tonsils.
Back in 1982, New England Journal of Medicine had an article published, and before that, it seemed everybody turned 5 got a tonsillectomy surgery. Suddenly it didn't. You don't know the article I'm referring to? Mm-hmm. What changed things? Why did we do it one day and suddenly we seem not to do as many?
Well, they what they found is that in children that were having a certain amount of strep infections or sore throats per year, which they defined as significant, which they defined as 7 infections a year for 1 year, 5 infections a year for 2 years, 3 infections a year for 3 years, those kids, if they had their tonsils taken out, did better. However, if it's less than that, they did not feel that it was necessary, and that kind of revolutionized our indications for tonsillectomy for infection reasons. There are other reasons why kids get their tonsils out, for breathing problems, for obstructive breathing, and snoring and gasping, but as far as infections are concerned, we kind of use those criteria to decide and help us decide if a child needs tonsillectomy.
Why do we have tonsils in the first place? God doesn't create a body and give us something. Must be a reason.
Well, tonsils are part of the body's immune system, just like the appendix is, just like lymph glands in the neck, and tonsils actually help fight infection because as things are breathed in through the mouth, the tonsils help find those little viruses and stuff and help fight the infection. However, in some kids, the system backfires, where instead of the tonsils serving as a protection for the body, it serves as a focus of bacteria and infection, and it actually harms the immune system while it's there. And in those cases, we would consider taking the tonsils out.
Is a tonsillectomy surgery a risky surgery?
Tonsillectomy is a very safe procedure. It's been done for a very, very long time. There is one risk of tonsillectomy of significance, and that is bleeding. And that bleeding happens in about 2 or 3% of cases, and it happens normally about a week or so after the procedure. And if it happens, it's something that we can help, but it can be very scary for the child. So we try. That's the reason why we try to avoid tonsillectomy if not necessary.
What about the risk of anesthesia? Is there any major risk of anesthesia today?
Anesthesia, when performed by a pediatric anesthesiologist in an otherwise healthy child, has no major risks at all. Any stories we hear of are simply that, they're stories. Kids do very well. It's very routine, not for the parents of the child, but it's very routine for the healthcare team, and in general, kids do very well with anesthesia.
Thank you very much.
You're welcome.